Welcome to Your Health. I'm your host, Rhonda Alford, and joining us on this episode is Dr. Brian Roberts, Emergency Medical Director, and Dr. Guy Lefort, Emergency Medicine Physician at Terrebonne General Health System, who will discuss with us the importance of pool safety. Welcome to the show, Dr. Roberts and Lefort.
Mm-hmm. Thank you. Mm-hmm.
All right, well, let's get started with you telling us a little bit more about yourselves and your roles at Terrebonne General. Dr. Lefort.
Sure. My name is Guy Lefort. I work in the emergency department here at Terrebonne General. And we take care of whatever walks through the door.
Never a dull moment, huh? All right, and Dr. Roberts.
I'm Brian Roberts, and I'm the medical director here at Terrebonne General. And we both feel passionate about this because, it's pediatric drowning that we're going to be talking about today. So,
yes,
we can prevent these. So.
Very important subject.
Yes.
All right, well, let's get started. Dr. Lefort, why is pool safety so important?
Well, unfortunately, Louisiana leads the nation in drowning deaths for children, and overall, it's the number 3 cause of death for children to age 14. And unfortunately, most of these are largely preventable, and that's what we're here to talk about today.
Dr. Roberts, what are some key safety features that every pool should have?
Well, every pool should at least have a fence. All 4 sides of the pool should have a fence and a gate. The gate should latch and close. You can get other features. They make, these gates don't have to be permanent. They make removable gates so that you can open it up if you have a party or something like that. They also make nets that cover the pool that you can get. They make pool covers. The pool covers, I don't really like them that much. The reason why is that kids can climb underneath them and then you can't see them underneath. Of course, the manufacturers say that that's not going to happen, but, that's always a possibility. There's some other things. Dr. Lefort is going to talk about some AI lifeguards.
Yeah. So the advent of AI technology, there's now sort of assistive lifeguards that have reached the market. There's a particular product called Milo, which watches for abnormal behaviors that swimmers may make while they're in a pool, and should recognize those and set off alarms. Of course, this is not the replacement for a good watchful eye, but any extra set of eyes that we can have to watch our children is certainly helpful.
Well,
we think about pools, but not only that, other areas, open water, lakes, beaches, and so forth. So anyone that may be not a strong swimmer, we should consider using things like life jackets in conjunction with watchful eyes.
Yeah, well, that's pretty interesting about the AI technology. Well, Dr. Roberts, what are some best practices for supervising children around pools?
Well, if you're going to have a party, a lot of these drownings, they occur at parties. People get distracted and they're just not paying attention. And so one of the things would be to hire a lifeguard. Assign somebody to watch the pool. Limit distractions. Somebody always has to watch the pool and watch the kids. Keep count of the kids. Don't allow kids to watch other kids. It's adults that need to watch the kids. If you need to go inside for something, everybody has to get out the pool and go inside. So also, if you have fences, make sure the gate's closed. Don't put objects near the fence so that kids can climb over the fence, ice chest or ladders or anything that's close by, because kids will use it to climb in to get to the pool. Mm-hmm. And so that's some of the safety.
Those are some good tips.
There's an old saying, if everyone's watching, no one's watching. So if you have a large gathering and everyone's swimming and having a good time, if we don't have someone that's designated to keep a head count on the children, then that's sometimes how that'll slip through the cracks. And of course, as Dr. Roberts mentioned, sometimes drownings can occur when we're not at a pool party. We can have objects and other ways that kids, being the rambunctious and exploratory beings that they are, find their way into the water. So, we have to be mindful of the layout.
Yeah,
Right.
and all non-swimmers definitely need to have floaties or life vests.
That's what I was just about to ask. How can swimming lessons or CPR even benefit pool owners?
Well, I mean, the better swimmer you are, the less likely you are to drown. Anytime we go to the beach, we're always watching out for the smaller children because they like to run full speed into the water. And, as a personal rule, standing next to it, they're going to have a life jacket on. And, they're going to fuss. And it's, Dad, why I got to wear that? And, they don't understand, but it's in their best interest.
Right, it's to save their life. So what steps can someone take if they do find someone found unconscious in the pool?
Well, it's a tough spot. If you're not used to dealing with this, your first instinct's to panic. The most important thing is to remember not to panic and to just kind of go through this. If you're going to be around water, just have a general algorithm that you've already thought out ahead of time what to do if you find this. So, obviously the first thing, you pull the child out of the water, and then you're going to check to see if the child's breathing and has a pulse. Activation 911 would be important, but learning to do CPR, rescue breaths, which are helpful in drowning incidents, and then good quality chest compressions is something that anyone could do to be prepared in general, not just for swimming environments.
Okay, well, thank you. We're out of time already. That was a lot of great
for having
information.
us.
We appreciate your time today.
Thank you.
For more information on pool safety and emergency medicine, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alford, and we'll see you right back here next week.